Thanks to those who just joined us. We're going to get started here in about 2 minutes. All right, I think we'll go ahead and get started today, Wednesday, the 14th, with the AgrAbility Virtual Summit. My name is Amanda Hargeth, and I'm the Outreach Specialist for AgrAbility of Wisconsin. I just want to welcome all of you here today and let you know that this meeting is being recorded as well, so it'll be available afterwards. Just a quick background on Easter Seals of Wisconsin and AgrAbility of Wisconsin and how we all work together. You can see below here that AgrAbility of Wisconsin is part of UW-Madison Extension and the College of Agriculture and Life Sciences, as well as the Department of Biological Systems Engineering. And at the bottom of that, you'll see grant writing and public education, outreach and marketing and all that stuff. And that's where you'll find me in this group. On the other side of our pyramid, we have Easter Seals of Wisconsin, our nonprofit partner, and the Farm Assessment and Rehabilitation Methods Program. And they handle all direct client services once we enroll our farmers and farm families. And then you can just see here a quick picture of our staff on the UW Extension and Madison side. We have Dr. Brian Luck, Dr. Richard Straub, and myself. And the farm program staff at Easter Seals is a little bit larger with Paul, Melba, T, Paul, Amy, Jeff, and Callie. Some of them are on this call or on this meeting as well. And we're happy to be working together to help farmers and farm families with disabilities. And today we're going to be, we're joined by Dr. Florence Becot from the National Farm Medicine Center and Maria Pitis, sorry, Maria, the University of Delaware Cooperative Extension Family and Consumer Science Extension Educator and County Director. And they're going to be talking today about a focus on previous findings from health insurance research for farmers and connections to the farm operation. And with that, let's see here, we're going to head right into the presentation. And then after that, after the presentation, if there's any questions or anything, one of our Easter Seals team members is going to speak towards the end as well. So with that, I will hand it over to Florence and Maria.
Thank you very much, Amanda. So I will start sharing my screen. All right, so as Amanda said, today we're going to be talking about health insurance for farm families, and we're going to talk about the research, but we're going to spend a lot more time actually on the practical side of things. So just to give you a sense of who we are, I am Florence Becot. I am at the National Farm Medicine Center. And for those of you who are not familiar, the National Farm Medicine Center is based in Marshfield here in Wisconsin. And a lot of my research looks at farm families' health, well-being, safety, and the connections to the farm business. And today we're lucky to have Maria Becot joining us. And Maria, if you want to introduce yourself.
Hi, I'm Maria Becot, and I work for University of Delaware Cooperative Extension. I've been there, oh gosh, a long time, almost close to 30 years. But over the last few years, I've been working a lot around health insurance literacy and developing resources with some of my colleagues from the University of Maryland Cooperative Extension. So I'm really pleased to be here.
Thanks, Maria. Thanks for joining us today. So since we, it's tricky, right? We can't be here in person and see your faces and get to know you, but we did have a question for you, if you don't mind entering it in the chat box, telling you, we were trying to get a sense of who's in the room today. Are you farmers? Are you service providers? And you know, that helped us, that helped Maria in particular tailor what the way that she can present the information for today and areas that she might want to emphasize over others. So yeah, please go ahead. Just tell us, you know, you can feel free to add your name as well. Tell us who you are and then what you do. And then since we have a packed agenda, I'm going to keep moving, but I know that Maria is going to be looking at the chat box. So in terms of our outline, the way we're going to structure our time today is we're first going to talk about the importance of health insurance for farm families. And we are going to, what I'm going to do is to present some of the research that I've been working on for the past 5 years on health insurance for farm families. But really the bulk of our time will be spent on talking about health insurance options and practical tools to select plans. And this is when Maria will talk over. And by the end of the session, our hope is that you'll know about important insurance options that are available to you and for your family, identify things to keep in mind when selecting insurance, and know where to get information about insurance options. We were going to talk as well about insurance options for your employees, but we realized that there was already a lot of information, but that's also something we can talk about with you as well if you're interested. And we're going to try to keep time for questions, but at the same time, at any time during the presentation, feel free to make comments in the chat box or ask questions. Maria and I, depending on who is talking, will be looking at the chat box. And if we don't have the answer for you today, we'll make sure to either get you that answer or connect you to folks who might have the answer. So let's talk, I think this would be very familiar to folks in this audience, but I thought I'd talk for a little bit about health insurance challenges in agriculture and the connection to health insurance. So we know that agriculture is one of the most dangerous occupations. We also know that agriculture is a very physically demanding on the body with wear and tear over the years. In terms of health challenges in agriculture, a 2018 study found that 19 farmers had a disability. And this was, the definition of disability was for folks who had benefits connected to their disability. In the 2017 study that I worked on with colleagues, we asked broader questions. And from the 1,200 farm families who responded to the survey, 60% said that they had at least one member with pre-existing condition, and 33% of the farm families said that they had at least one member with a health condition that made it difficult to farm. What's interesting to note too is when we looked at how does that vary, you know, for different age group, when people report a health condition that make it difficult to farm, what we found was that it was across the board, across age groups, there were no differences. And so in reality, what we know is that there are wide impacts of health challenges on quality of life of farmers and of their family, on the ability to work, and on the farm business. So that gets us talking about health insurance. And we know and how health insurance might play out into broader farm planning. We know that a thriving farm depends on important building blocks, and the one that we tend to talk about tend to be connected to the farm business, such as access to land, access to capital, and a business plan. There are building blocks too that we might not think about as often, but those building blocks such as health insurance, disability insurance, they can play an important role in ensuring that there is a safety net in place for both the family and the farm business. So at the same time, where we say that health insurance is important, we know that health insurance can be expensive and difficult to navigate. And indeed, in the research that has been done asking farmers, you know, how do you feel about health insurance? We know that it's an important stressor, and we know that the cost of health insurance is as much as a stressor as the cost of land, for example, and so forth. And so before I talk a bit more about what health insurance look like for the farmers that we've spoken with, I'd like to ask you, take some time to ask you questions about how maybe you feel about health insurance, your comfort level with it, and then we can see how what folks in the room are saying compares to what we found in our study. So I'm going to launch a poll. It has 3 questions, and what I want to say is we don't know who answers the questions and how, so feel free to answer them. And then I'll give you, they shouldn't take too long, so I'll give everybody about a minute to go through the poll. All right, so far it looks like about 5 people have responded, 7. So I don't know if a few more folks want to share before we share the results. All right, so I'm gonna close the poll. So it looks like for the folks who responded, 7 of them, for 86%, sorry, said that healthcare or health insurance limit the investment that they make on their farms, which is similar to what we found in the past. Given your current financial and health insurance situation, in terms of the confidence in the ability to pay for major illnesses or injuries without going into debt, 43% of folks said they were not at all confident, 14% were slightly confident, and then about, it looks like 28% were either were confident at some level. And then the last question was, how confident do you feel in choosing health insurance plan that meets the needs of your family? It seems like the majority of folks said they were slightly confident with 43%, and then a split for folks who were not at all confident and folks who were confident. All right, so let's move. What I'm going to talk about now are just a few findings from the health insurance study that I mentioned before. And what I will say very briefly is this was a study funded by the US Department of Agriculture. And the goal of the research and extension project was really to understand how does health, first of all, what type of health insurance, what does health insurance coverage looks like for farm families? And then how does health insurance impact economic development through food and agriculture, and also impact the farm and ranch on a range of issues such as their development, workforce vitality, risk management, quality of life, and family health. And I will note that the lead researchers on these projects are Shoshana Inwood from The Ohio State University and Elena Knudsen from the Watch Center for Health Analysis. So in terms of sources and cost of health insurance, when we ask people what, where do you get your health insurance coverage from? 41%, the most frequently used plan was plans from off-farm employment. And then followed by public insurance coverage, 36%. And it's true that when we look at differences between under and over 65, we get some differences. And then the last most frequent types of plan was direct purchase of a private policy. So this could be directly through a broker or on the health insurance marketplace. What we noted is that 27% of farm families had more than one plan. And a lot of it has to do with, for example, if you're eligible for Medicare and Medicaid, if one person in the household is, Medicare in particular, the other person might not be. In terms of the cost, at the time of the study, average premium cost was $750 per month with wide variations based on the source of coverage. So what we found is that the cheapest source of plan was for public insurance coverage. And then after that, it was off-farm employment was cheaper. And we found on average, it was $538 per month. And what we found was that the most expensive type of plans were the ones purchased on the private on the insurance marketplace. And Maria will get into some of those details in a minute. The last piece that I want to touch on are connected to the challenges of health insurance. What we found, and that's similar to what we knew from before, is that more than 1 in 10 farm families had health insurance. But at the same time, we found challenges associated to underinsurance, to high expensive plans, high deductibles, high out-of-pocket expenses. When we looked at the data, when we compared for families who said they had a health condition that made it difficult to farm versus the families who did not report any major health challenges, we found some important differences. Families who had health challenges were more likely to report that they had a medical debt over $1,000, and they were more likely to be concerned in their ability to pay for major healthcare costs without going into debt. Here we see 64%, and they were 65% of them too were saying that health insurance costs limited their farm investment. And so what an important piece too is that health insurance, the farmers that we spoke to really saw the importance of health insurance as a risk management strategy as reported by 80% of all the farm families. So that's the part that I'm done with the research piece. And now we're going to go into the more, the practical side of the presentation when Maria is going to talk about health insurance options and resources to select plans. So Maria, I'm gonna stop sharing.
So you can see that, right? So I'm just going to go back a slide too, because I wanted to point out, as you look at this chart, that even though those folks that had health challenges, 64% of them are worried about the ability to pay for a major healthcare expense, look at those folks even without any health challenges. 50% of those interviewed said they're worried about the same thing. So what we're finding really is that people are stressed out about this, whether you're a farmer or not, people are stressed out about this. And so I just wanted to share that because people are, what we have found in our research is that many people are very confused. People are still very confused about health insurance, and that adds a lot of angst around making decisions. And as you all said, as you took the poll, not confident that you have picked the right plan. And so that has been part of what we have tried to do with our health insurance literacy initiative, is really develop tools and resources to help people kind of choose a plan as well as use a plan effectively. So today, as Florence said, I'm going to talk a little bit about options. You know, it's a lot of information. It's confusing. And so unfortunately, we have like 30 minutes. So I'm going to go through quickly. So please feel free to ask questions in the chat. And I'll do the best we can to answer your questions. So one of the things I think that's really important is to recognize, I'm going to just put them all up here, that the Affordable Care Act required that healthcare plans have some of these, at least, they have to offer some level of all of these types of services. And that goes for those that are offered through the health insurance marketplace, as well as, I'll just call them full service plans, as opposed to skinny plans, right? Skinny plans can choose not to offer some of these. And that's one of the reasons why they're a little bit less expensive. So that's really important in terms of trying to pick a plan that is going to fit your needs. You need to think about which of these services that you need to support your family. All right, so the other important piece is that we look at plans, factors that contribute to whether it's the right plan or if it's available is, you know, which state you live in, you know, what are the policies and the plans that are available because of the state that you live in. Plans may be available depending on your age and income. So lower income, there may be some things that are available to you. Age certainly is part of that. If you're over 65, eligible for a Medicare. Some plans are available to you if you have a disability or a chronic illness, as I'm sure many of you know, as being a part of Easter Seals. You may have some subsidies or tax credits depending on the number of family members that you have, or if you're an employer, right? How many employees you have. It also, factors that can contribute to your choice of plan have to do with what kind of business entity you have in terms of our farming populations. And so, as Florence said, there may be multiple insurance streams, for lack of a better word, depending on the kind of size of your plan, the income, your health situation, and those things. And that is typical of the farming population. So now we get to talk a little bit about healthcare plans. So one of the key resources in Wisconsin is this lovely website, the Wisconsin Healthcare Options. It's a great place to kind of start if you haven't looked at the healthcare marketplace and the marketplace supported through the Affordable Care Act and the Medicaid program, which in Wisconsin is called the the Badger Care Plus. So both this website is a great resource to just get started to explore some of those options if you're not familiar with them. We'll talk a little bit more about those in a second. One of the resources I wanted to share with you is this My Smart Choice Health Insurance Workbook. And it is a comparison shopping tool that helps you kind of look at, well, what are my needs? How do we use health insurance? And then based on that, typical use of healthcare services, how can I estimate how much I might use, and how do I comparison shop across plans to see what that out-of-pocket cost might be. And it can be a little surprising. Sometimes costs with, plans with lower premiums end up being more expensive because the deductible is so high. And so it's really important to comparison shop. So this is a tool, a resource, and you know, it will list it again at the end, and but it's a great place to kind of start. All right, so when we talk about what are the options, you know, these, you're going to know these, right? This is not rocket science in terms of the kinds of options that are out there. And so what we typically find with farmers, they may be covered by their spouses or even their own off-farm employment opportunities. And so that off-farm job then is the thing that is providing the insurance to cover them. There may also be a member of something like the Farm Bureau or the Farmers Union or even the local Chamber of Commerce where they could be getting insurance there. Another option is certainly the health insurance marketplace. We'll talk a little bit more about that. They could be purchasing a health insurance through either the health insurer, right, like Blue Cross and Blue Shield, or through a broker or dealer. And so we'll talk a little bit more about that. There are these things called skinny plans, or there's short-term kind of gap plans. That's a resource out there. They could be getting them through the Armed Forces health insurance. They could be getting it through Medicaid or the Children's Health Insurance Program. And then lastly, Medicare. So this may be kind of the combination or some combination of these different sources of health insurance could be helping to support a farm and their farm family. So let's just talk a little bit about off-farm employer-based health insurance or an association membership. Oftentimes this is some sort of a group policy that's offered through that place of employment or that organization like the Farm Bureau. And you know, the benefit certainly is that you've got health insurance, and oftentimes these plans are less expensive than other alternatives unless you qualify for some sort of tax credit or subsidy through the health insurance marketplace, which we'll talk about in a second. And depending, there may be several plans to choose from, so you can actually pick one that fits your situation. So you definitely want to check to see if plans cover all of your family members. Sometimes the deductibles are high, and so you really want to work with your employer's human resources representative or the health insurance plan directly to figure out whether it's the right fit. So what about the marketplace, right? The health insurance marketplace is the thing that kind of got put in place in 2014 is when it really kind of opened up, but it's was put forth by the Affordable Care Act. And so these plans are negotiated through the Insurance Commission's office. In Wisconsin, Wisconsin has the U.S. government as their kind of marketplace provider, so they're in cooperation. It's easy to enroll by going to healthcare.gov. And one of the things that that can happen when you go to that healthcare.gov place is you put your zip code in, and it connects you right to the resources that are available in your state or in your location. What's nice is after the election, right, there was an extension in terms of an open enrollment period. So now we can actually enroll in these plans as of August 15th of this year. And one of the other really key pieces that happened is that so there's a rule in the Affordable Care Act, especially if you're getting subsidies and tax credits, is if your income increases over the year. So the plans and the credits and the tax refunds that you get are based on last year's income, right? And so one of the caveats is if this year your income goes up, it could impact what that subsidy is, and that you have to pay that back. And so that is one of the challenges. But for this year, given everything that's happened in our economy, the Biden administration says, you know what, we're not requiring people to pay back those premiums if your income increases. So this is a huge, huge benefit. And I really encourage people to think about that if you're eligible for those tax credits. So the tax credits are provided for those people making 400% of the poverty level or lower. And that can be pretty high. And I've got a case study here in a second. And those tax credits then offset the premiums. And oftentimes the plans, there's a number of plans that you can kind of comparison shop so that you can really find the plan that best suits you. So healthcare.gov is really the best place to go. And if you go there and you put in a Wisconsin zip code, you will get the information for Wisconsin. So here is my little, one of my healthcare marketplace examples. We have Jim and Lynn, and they own a dairy farm, and they've got 4 kids under the age of 18, and they're all non-smokers. And together they earn about $106,000 a year. They live in Clark County, Wisconsin, and given even that high of an income, they are eligible for an advanced premium tax credit. And so based on the calculators that are available, they're living at 301% of the poverty level. And based on that, they would be paying $534 a month for health insurance for all of the people, right? And that they would be getting almost a 28 and a half thousand, no, that's not right, 2,886 dollar subsidy, right? Because the normal premium under normal circumstances would be close to $3,400. So this is key. And I think this is the piece that most people don't realize, right? It's worth going to check it out to see if you are eligible for a tax subsidy or credit. So what about the Medicaid and the Children's Health Insurance Program? Both of these programs are offered to individuals based on income and family size. There is no open enrollment period for either of these programs. People can enroll whenever during the year. And I really encourage us to think about these programs. For many farmers, they may be eligible, right? Their income is low enough, especially over the last couple of years, where their income is their income is eligible. I have a brother-in-law who's a sheep farmer. He's in Kentucky. He was paying $1,500 a month for himself before the Affordable Care Act. Once the Affordable Care Act came, he was paying $51 a month. So it can be huge. So here's my example. Here's Sam and Sally. They're also dairy farmers, and they still have those same 4 kids, but together they earn $47,000 a year. They also live in Clark County, Wisconsin. So based on the healthcare.gov, the children are eligible for CHIP and the adults are eligible for subsidies that cover the premium costs. They're living at 134% of the poverty level. So they would be eligible, right, for those insurance programs. And so Medicaid.gov or the Badger Care are the best places for information about there. I know sometimes we get questions about Medicare, right? And Medicare, believe it or not, is people who are not 65 are confused about Medicare. And so it's kind of important to recognize that this is a resource, especially for people who have a disability. But Medicare in general is available to those who are 65 and older. I think one of the pieces that most people are confused about when it comes to Medicare is kind of that time frame, and especially now because, for example, my full retirement age is 67, but I need to apply for Medicare at 65. Like, people link the two, and they shouldn't really be linked when it comes to enrollment. So there's Medicare, and you have an enrollment period, and if you don't enroll during that time, there could be a penalty. And then we've seen tons of commercials about the Medicare Advantage plans. These are sort of like an HMO version that covers medical and dental and maybe vision, but it's not available in all areas. So again, it's some comparison shopping. People are very confused about that. And then of course you can buy supplemental insurance. Medicare typically covers about 80% of the healthcare costs. So that Medicare supplemental insurance is used to wrap around Medicare and help cover the rest of that 20%. And so Medicare.gov is actually a really great resource. Now, one of the things about Medicare is if you have a disability, you you are eligible. And there's probably some folks on this call today who know a lot about this, right? But you need to be, if someone can apply for Medicare, if you're under 65, if they have a disability, and the disability is defined as the inability to engage in any substantial gainful activity because of that physical or mental impairment, which may be expected to result in death or which lasts for longer than a year. So under Medicare disability, you automatically get Medicare Part A and B if you have been on disability benefits for Social Security for longer than 24 months, or SSDI. And so, or through the Railroad Retirement Board, again for 24 months. And then each year during that re-enrollment time, you'd have to reapply, right? Well, not reapply, but evaluate whether you have the right insurance. Okay, so Social Security disability insurance pays a benefit to you and certain family members based on the number of quarters that you have worked. And so it's very important to be paying into Social Security as you go along. And that's an important piece. It's not so much how much you contribute, but that you have to have a certain number of years. And so, or a number of quarters. And so on the bottom half of this slide is really some of that math, I'll just say, right, in terms of how many quarters you need to have paid in order to be eligible then to get the Medicare disability insurance. And so Social Security Administration is really one of the best places to get information. So I wanted to go over this example as well. And so now we have Tom and Talia. They own that same dairy farm. They still have the 4 kids, all under the age 18. They earn that $47,000 a year. And Talia receives an SSDI benefit of $1,100 per month because of that farm accident that happened 5 years ago. And she can contribute some help to the farm operation. So based on healthcare.gov, the children would be eligible for CHIP, the CHIP program. Tom would be eligible for subsidies that cover most of the premium of the health insurance. And because of Talia's disability, she would be eligible for the Medicare health benefits and eligible for some prescription drug coverage. So that is an example of how there's multiple streams of insurance helping to cover a farm operation. So that, as I said, that's an example. And certainly some of this would change a little bit depending on the amount of income that they would be earning. So another place where you can get insurance is certainly from the health insurance company themselves or through a dealer or broker. I think one of the key pieces here, again, is shopping around. And as you're working with a dealer broker, you want to be sure that they are, providing you with a good assortment to choose from and not just brokering the ones that they're going to get paid most for. It's important to know that health insurance agents and brokers can be certified to offer marketplace plans. They go through a special little training, and you can find who those people are by going to that healthcare.gov website and putting in your local zip code. So that's important, because then one of the options that a broker can share with you is your options under healthcare.gov. You also want to be sure that anybody who's selling you insurance is licensed in your state. Very quickly, people who are retired from the military or part of the military could be getting TRICARE or services and insurance through the veterans, through the military, and services through the Veterans Administration. So I want to just talk a minute about skinny plans. They really have limited benefits. You know, many people are drawn to these because they are less expensive than plans that are on the marketplace, but they don't necessarily cover as many of the medical services. They don't have to provide essential benefits. They can deny coverage to consumers with pre-existing conditions. There may be limited medical benefits that pay for routine care or don't pay for catastrophic care. So all of that is sort of a huge caveat, right? You really need to know what you are getting into if you're thinking about a skinny plan. And then there's things like, you know, gap insurance plans. And so these are really designed to provide an emergency safety net, say in between situations. Another way to think about this, I think of the duck, right? Aflac, right? So Aflac maybe, so it's a different insurance premium that's paying, again, sort of like wraparound medical coverage for a plan that you have gotten somewhere else. So again, you need to kind of make sure that a plan that you have and a wraparound plan fit together nicely so you don't get stuck with a big healthcare bill if you have a major medical event. So you definitely want to go to your local insurance department to see, you know, who's licensed to sell in your state. So what documents provide the best information? Well, when we're talking about Medicare, Medicare.gov has had a lot of updates over the last couple of years. It's a very user-friendly website, actually. And healthcare.gov, again, they've had some people help design it who are good at communicating complex things in simple ways. And I've been to the Wisconsin Health Services Department web pages, and they are nicely organized and have a lot of great information on there. So those are sort of the web-based things. But the other important place to get information is through your evidence of coverage. And so this is the document that comes to you when you get a plan, right? It has all the details. It is what I kind of think of as the contract, right? You're paying this premium. Here's the detailed contract of what that healthcare provider, that health insurance provider is offering you. And so many of these now are online, and some health insurance companies actually still mail them to you, but it's important to take a look at that and keep a copy of that so you understand what your health insurance plan covers. So when we talk about resources in Wisconsin, there's some really great tools out there in terms of something called Covering Wisconsin. It's their official licensed health insurance navigator agency. And so one of the things that got created as part of the Affordable Care Act is kind of the creation of resources to help people navigate health insurance purchasing, especially on the health insurance marketplace. And so there are kind of written resources there that can help you better understand insurance. But many of those navigator agencies also do one-on-one and telephone conversations to help people kind of better understand what their options are. The Wisconsin Department of Health Services has a really great website, as I mentioned before, and they actually have kind of a website designed for farm residents and workers. So there's a place you can go directly. I wanted to point out the Wisconsin Department of Health Services also has a program called the Senior Health Insurance Program. And this is really designed for people who are getting into those Medicare years and are trying to make some decisions about, you know, do I use a Medicare plan? Do I use a the Medicare Advantage plan? Do I buy a Medicare supplemental plan or Medigap plan? And what are my options? And so these folks are paid and also volunteer, usually seniors who've been through it, and can help people really sort out through all of that advertising that happens that can be very overwhelming. And then, of course, finding a good local insurance agent if that's the road you choose. And to help you choose, you can go to this website to get more information. Lastly, we wanted to share some of the University of Delaware Cooperative Extension resources and the University of Maryland resources. This is Health Insurance for You. It's sort of an online learning tool. So this is the web page. If you go to the web page, it's almost like a course, and you kind of like take a little pre-survey, you watch a video. Hey, here's some handouts that go along with that video. Here's the next video. Here's some handouts that go with that. And it just sort of, each of the videos is maybe 3 or 4 minutes and provides some, overview. And then here are some things that you can do for yourself, right? A very applied piece. My University of Maryland Extension colleagues, they have a whole website called Insuring Your Health. All of the work that has been done by our health insurance literacy team is posted there. There are resources for consumers. There's resources for educators. We have a tab just for farmers. And so some of the research that has been out there has been done is there as well. And then here again is that website for this Smart Choice Health Insurance Workbook. I wanted to point out that many of the resources offered through the University of Maryland and Delaware have Creative Commons licenses, meaning you can use the resource, but you have to pay attribution. You can't change the resource, that kind of thing. So I just wanted to share that those are resources that you're more than welcome to connect with and use in your practice, or as you're trying to make good health insurance decisions. And here is how you can connect with Florence and I. If you have multiple more questions, we'd be happy to visit with you. And I think my time is about up. And I wondered if there are any questions for Florence and I. That was quick, I know. No questions?
That's pretty impressive. You must have explained everything super well with no questions.
Either that or everybody's brain is whirling. So.
Well, I do want to thank Maria and Florence for joining us today. I do have a quick poll just to get some demographic information on everyone who joined us. So if you could fill that out and just rate this session, then if you scroll down, there's a couple additional questions on that. And I'll leave that poll up for a couple minutes here just so everyone who wants to can get that filled out. As a reminder, tomorrow we'll be hosting our last virtual summit session at 11 a.m. Central Time. The presenters will be 3 people from the Wisconsin Farm Center, all talking about farm financials, different aspects of that. So make sure that you come back tomorrow for our last session. And yes, this presentation was recorded. I see there's a questions for if you can share the PowerPoint. And this presentation will then be uploaded to the AgrAbility Wisconsin YouTube channel. It will also be on our website. If you want the PowerPoint specifically, maybe you could reach out to Florence or Maria. I'm not sure what their preference is.
Yeah, Amanda, and we'd be more than happy to share the slides. We just have to clean them up a little bit so that, because we had some animations, but yeah, we would share them for folks who get in touch with us. Thank you.
Yeah, that sounds great. All right, I'm just gonna leave this. It looks like we got almost everyone on the poll, so I am just going to close this here in just a second. Otherwise, we should be good to go. Thank you everyone again for joining us today. Really appreciate it.